Chong SS, can you unmute yourself? Joanne asked you to unmute. Chong SS, can you unmute yourself?
Yeah. I'm here.
Yeah.
Can you hear me?
Sure.
Right. Okay.
Hi.
Hi.
Okay.
How are you?
I'm
Okay.
very good.
Thanks for having me here, and thanks to Joanne, okay, for introducing me.
Sure. Thanks for your kind words. So,
Okay.
you
So
have
sorry because I'm actually I'm driving, but it's okay. I just stopped aside, but it's okay. I can talk.
okay.
So
Can
the condition of okay, my friend is actually with me earlier. So
right.
what his condition was, right? He has been diagnosed with a CKD stage 5.
Right.
When he started up with this X39 and Aeon, at that point of time, he's actually at a CKD 4th stage maybe.
Right.
So now that his EGFR has gone really low, he's
Right.
requiring dialysis perhaps in about a month or 2 times.
Right.
So I'm not very sure when, because the doctor has not actually given him the green light at the moment.
Right.
So, but he has actually gone for the fistula insertion. So the doctor doing that was actually to prevent in case of any emergency cases, right? He do not have
dialysis.
to go through the neck part,
Right.
You can just use the fistula just to, just to do the dialysis.
Right.
So everything was going on perfect. I think, to be honest with you, he has been not really keeping up by the rule book in a way, because how do I say, when you have chronic kidney disease, right, there are certain things that you have to take care of. Number one
Right.
thing is, of course, your diet.
Right.
Second thing, with adequate exercise and rest, that
Yeah.
would be, I mean, all this in combination, right, would definitely
Right.
give a result. But I would say that he is doing it, but not in exactly like 100% kind of thing,
Right.
maybe 20-30%. So,
Right. Oh.
so the reason one he tried on the CRP, he can see a drastic drop in his EGFR.
Right.
From like 11 now, he's actually 9, perhaps 8
Right.
now. So
Right.
the doctor has already given a fair warning that, okay, this dialysis will have to start soon.
Right.
But coming to a point where when you started up the Zoom just now, right? I
Right.
heard from the point that actually you don't have to do the test so fast right after you
Yeah.
do.
Yes.
Yeah, but he did it almost right immediately. So the
Ah.
reason why I think we had a misconception.
Yeah.
The first thing first was we thought of like, after doing that 15 days, right, better get tested out so that you see the results.
I
But
see.
when the results come out, it was a little bit devastating, and it actually
I
kills
see.
him in a way, lah.
I see.
But
No
but
wonder.
after realizing this, right,
Yeah.
I've spoken to Joanne as well. He has gone through quite a few phases. Number one, he did notice that the urine part is murkier, but then he doesn't have to go as often as he does during his nocturnal times. Now, that's number one. Number two, he does feel a little bit more lethargic than usual. But number three, in terms of when he started up, honestly, when he started up with X39, right, I can literally see that his complexion has gone from dark to fair. I won't say 100%, but at least improved by 20-30% or more.
Wow. That's a lot already.
That's a lot, and especially people with kidney diseases, or I would say chronic kidney failures, right?
Yeah.
Because our body is not be able to dispel toxic. So one
Yeah.
thing that will show very visible is on the facial, where you can see there are black spots.
Right.
And then you get a little bit more itchy at certain area of your, your
Right.
skin and sorts, right? Okay,
Right.
that persists, but the black spot did slowly gain like a little bit lesser and lesser. For one thing that he noticed, even behind the ears,
Yeah.
usually he will feel some rashes kind of thing, but it's actually not rashes. It's just like you
Right.
can actually feel some kind of protruding rashes over there. It's neither pain nor itchy, but it just gets more. But after using the X39, right, it did reduce.
I
So
see.
on a good note, other than that, I think on the positive side, I would say that it helped him
Right.
prolonging the defeat, in
Right.
this game. But
Right.
entirely all these things also have to be rely on one person's will.
Yeah.
You cannot expect having this miracle thing that you can really cure you, but you have to put
Right.
an effort. But I would say his effort is not really there.
Right.
So maybe you have any suggestion that you can actually give me on how to let me just see through how can I, help him out in this case.
I see, I see. Okay, so the most important thing you ask him, does he feel that the body generally feel warmer, and does he wake up less often at night? Hello? Hello? Hey, how come? Okay, Sean, can you unmute yourself again?
Yeah, can you
Oh,
hear me
okay.
now?
Can,
Sorry.
can. It's
Yeah,
okay.
yeah. He did.
Yeah,
He did. He felt warmer. That was the thing that he says is he having fever.
I see. This is very important. Your body need to get the heat up first. If the
Okay.
body heat is going to go up, right, the body is going to do a lot of removal of the toxin.
I
So this
see.
is why, right? Does he have this increase of a few feverish during the CRP?
Yeah, it does,
I see.
consistently throughout the start point
CRP,
of
right?
using it. Yeah,
Yeah, for sure one. It's always as expected for someone who have CKD because the kidney is like drying up already, like no engine already. Now you
understood.
reactivate the engine, it's like the car. You never use it, it's very cold. Now the engine once started already, then the car will become warmer already. The engine, the
Okay.
car. So if the body feel warmer, it means that the kidney still got the chance to revive and is reviving well. So
Okay.
those kind of feverish, the body, the circulation get better, the metabolism get better, the metabolic waste, which
Right.
including the creatinine, it will get
Right.
higher. But when
Okay.
the doctor translate the creatinine to EGFR, it will look lower.
Okay. Okay.
Yeah,
That's also a good pointer from you because earlier you
yeah,
said, with the meat consumption that he does, I mean, or any people with a CKD does, right? It does
right.
increase the creatinine, sorry,
Yeah,
decrease that. So at the end of the day, I look at his diet. Yep, he is actually a very much a meat eater.
yeah, yeah. So this is this. If you really don't want to do dialysis, this is something that he had to change. If you really want to eat meat, right, just eat white meat. Chicken, fish is fine temporarily before the EGFR go above 15, right? We just reduce red meat first. If you want to take, it's still okay because red meat there are still some benefit also for
Right.
the kidney also, but not in big volume because it's not easy to digest. And then the rest of the thing just make sure enough water.
Right.
Does he complain any
What
difficult?
water wise, I think he is well above the normal level.
Okay, then it's good enough already. So I think for me is everything is going well. It's just that the point of doing the blood test is a bit too quickly already.
Yeah. Maybe what we on a positive side, right? He's probably needing another one. Okay, this is actually as prescribed by the doctor. He has to do the
Yeah,
test every 1 month.
yeah,
So every month he has to go back religiously to get it done. So the next one upcoming will be early of next month. Let's hope during that time, right, the results shows differently. Then probably we can tell more from there. Lah.
yeah. And then, but for me, if he really get better, right? If overall he feel better, I, I see so many cases is as the body get weaker, the body try to increase the frequency of blood draw. So the
Right.
more blood draw from your body, right, the kidney get weaker. So that means even no matter how healthy you are, if you continue every year you go by the blood draw, right, they will come to the time your kidney cannot tahan one.
Okay, understood.
You get to
Understood.
understand? Yeah.
Right,
So
right, right.
for me, right, if can just drag a little bit longer, maybe 2 months plus, then do a blood draw. As long as the body is feeling warmer, the skin is fairer, the hair is darker. This is all the sign the kidney is getting better already.
Okay, okay.
Yeah.
The hair part I couldn't determine because he has this hereditary white hair syndrome.
I
So he has been
see.
having white hair as soon as he touches 25th, 26-year-old sorts like that.
I see. I see.
So
Okay.
I mean it's not
Okay.
totally white lah, but you can definitely see it's graying out.
Okay.
So
Okay.
so that part I couldn't tell much. But other than this, right, all the positive notes, I
I
have
see.
taken note and in fact it did happen lah.
Amazing.
So finger crossed. Let's see what's coming up on the next
Yeah.
two weeks time. Well,
Yes.
he's actually continuing on the non-CRP right now. He's still religiously doing the X39 and Aeon lah.
Yeah.
So I will talk to Joanne if he requires him to maybe go another one more session with the CRP and see how it works.
Right. Okay. If you want to go for CRP, just make sure the blood test is not so close.
Understood. Understood.
Yeah.
But
Yeah.
unavoidable lah because the doctor prescribed him to do the blood test every now and then.
Yeah. Yeah. Oh, I think this one is still up to him to decide. He can always say, "Oh, now I struck out with the flu. Can you delay this to next month or so?" And I am not someone who advocate every month blood draw.
Yeah, I agree on that part also.
Yeah,
Yeah, I
it's too
think
daunting already.
yeah, I think you make a point because the doctor
Yeah,
also did not tell him to do dialysis as of next month.
yeah,
In fact,
yeah.
the doctor say can literally wait on for another 6 months. So maybe
Ah,
3 months can wait a little bit longer. But anyway,
yeah,
single digit EGFR is never good. But as you said, right, and I believe so, that your intake, your diet intake and salts, right, actually plays a foul way in it. And
yeah.
to be completely honest with you, one thing my friend has, he's a habitual smoker.
I
Habitual
see.
as in like, taking 20, 30 cigarettes a day. I'm trying to reduce it for him. Yeah, I think it worked, but not tremendously well.
Wow. Okay.
So
Wow. You are such a good friend. May I know what is the relationship with you and him? Is it you all grow up together?
yeah, we grew up together. Yeah, he's a guy and I'm a guy lah. Otherwise people thought we are gay, but actually we are not.
Wow. This brotherhood, man. Okay.
Yeah,
Okay.
yeah.
Hopefully
Okay,
he listen to you. Yeah.
sure.
It's
Thank you so much,
so
Jinlong. Thank
yeah.
you for your time.
So just for your reassurance, right? You go online and check about EGFR. How is the calculation of EGFR done? Then you read through it. Oh, then you know EGFR is not like a predicament exactly
Correct.
how the kidney function. Then it's okay.
I,
Then you
I,
know
I
this
went
logic
through
is
it.
fine. Went through it,
Yeah, because
Okay.
when he was first diagnosed with it, right,
Yeah.
I did some research. I from a science background, so I have a
Right.
little
Right.
bit of understanding of here and there.
Yes. Yes.
So maybe I'm really half a nephrologist by the time I'm finishing up everything. So hopefully it helps lah. But
Sure.
anyway,
Sure.
I'm seeing positive things coming out from these patches and sorts.
Yes. Yes.
That's the good part.
Oh, good. Good. Okay. Awesome.
Right.
Thanks, Chong.
Thank you
Thank
so
you.
much. Thank you so
Thank you. Bye
much.
bye.
Bye.
Wow, so soon. I just talk about dialysis. Then one case. So guys, you understand the logic or not? Because when you do CRP, right, it's not saying that on the 16th day you finish the CRP, then the body stop detoxing. No, no, it's not like this, right? It's like your kaka. He come to rinse your house, right? Try to throw all the dirty things outside, right? You don't expect the moment your cleaner left, your whole house become clean. No, maybe the kaka will still put some rubbish at the doorstep. There are still some muddy water in a longkang waiting to drain off. There are still some residual things that haven't been completely settled down. So in this time, you ask someone to check, he will say, how come the rubbish is still there? Because it's still waiting the truck to remove them, right? So you need a time run. So when you do a CRP, don't get it any blood test very quickly. Okay. But if you someone who has CKD, right? Trust me lah. Life wave is I'm so sure that it's going to help you. The changes, number one, is definitely your body feel warmer. When your body feel warmer, it means that the kidney engine starting to activate it because kidney is where the fire is. This is why for a young man, when you see a young lady or when you see a very sexy lady, right? Wow, your body feel hot, It's because your kidney is so strong. When you get older already, right? People say your kidney tak boleh tahan already. You see even a lady wear bikini or you nothing excite you already. It's because the kidney cool down already. So kidney is where the young, the fire come from. So when you young energy improve, your kidney improve, right? Your body feel warmer. And if you do CRP, right, you always feel your body feel very hot. Like exactly the case during CRP, feel every day throughout the CRP very very feverish. Feverish because the blood circulation get better, the kidney yang qi come better. You want to remove the toxin. And this time you go for blood test. For sure go haywire. Do you learn something for the topic? And then the body, number one, feel warmer. Number two, skin sure get fairer. Because the metabolism increase a lot of ways, because your kidney cannot detox, right? Now your kidney get better, it can remove toxin better already. Your urine, you will see some changes. And slowly your skin will become fairer. Do you learn something? If you learn something, that 555. If it is miracle, that 555. Fourth or fifth stage, chronic kidney diseases, is able to see this kind of reversal, in terms of the outlook. And doctor say can wait for 6 months. I tell you, today I see two good doctors, One doctor is for Margaret, say they got blood clot, don't remove, it will resolve. First time I hear doctor say this. Number two, number two is this case. EGFR drop below 10 already, still can wait for 6 months. I tell you, if other doctors, right, you below 15 already, for sure want you to go already, But now 9 still can tahan. I think now the doctors also understand already. After so many of their studies, right, it's actually can wait one. Even you go to 5-4, it still can wait one. Okay? As long as you don't feel like dizziness, you keep vomiting, it's fine. Why I say dizziness? Because the toxin is so much, the kidney cannot detox out. It start to erode your neuron already. Then it's very bad already. Then it's better you clean off the toxin with the machine. Other than that, is perfectly fine. Okay. Manhood, brotherhood, right? Fight for my friends. My friend stage 5. I want to ask everything. I help him to observe himself. He don't care about his body, doesn't matter. I help him take care of him. Wow, amazing. If every one of us is like a brotherhood of men, right? How good it is.